use is that the women who go have abortions are disproportionately more poor. You don't get rid of the poor by killing the poor. You don't do that. They are people with dignity, just like we all are. And this idea that you can, that might be a quick solution, there are some really long-term ramifications from that. And then ultimately, you want to love enough so abortion becomes unthinkable and change the dynamic. You want to change the dynamic of the debate. It's not a right. It's not a duty. It's not a. We believe at our place that medicine is an act of mercy, helping people who are ill. And so it's 7:35. I talked a little bit about the situation at hand. I talked a little bit about my story of being out there doing some of the terminations and not finding a lot of the joy and a lot of the peace that I was finding. And then we talked a little bit about some of the risks, and then we talked about what we're doing now as our approach to medicine. And I'm going to open it up for some questions here. Anybody with any questions? Yes, sir.
So I was wondering there, you said that oftentimes from from the pro-choice perspective, or that some people from a pro-life perspective may be too extreme because they are oftentimes just so focused on the baby and not the mother in the situation.
Yes, sir.
I've seen, and I'm sure you're obviously aware of this being pro-life yourself, that to be pro-life means to be pro-woman. So what I wonder is to being so focused on the woman,
yes,
and the baby at the same time. If that is not screaming out to people in the world just out there, what are some tips and advice you can give for us to be able to change that perspective, that whenever people think pro-life, no matter if they're pro-choice or pro, whatever, they're going to think, oh, you're pro-woman.
Right.
How can we do that besides the facts that you've given us?
No, listen. Oh, no. I love that question because it goes to the heart. The right brain people who did a lot of focus groups for a lot of Fortune 500 companies, they looked at this abortion piece from the point of view of the woman having the abortion. That's where I came up with that ethic of there's three evils: motherhood, adoption, and abortion. And abortion is just the least worst of those three evils. So this idea of being focused on the whole person, the only way that's going to happen is if our language says that. But more importantly, it's your actions. It's your actions. Are you serving? Because once again, this young man up at Charlottesville said, but Dr. John, if we just show them the humanity of the infant and show them on the ultrasound machine the moving, well, maybe that worked 15 years ago. But it doesn't work as well today. Because the stresses and the strains, this issue of life is a real challenge. And at least our focus groups are telling us that the message doesn't resonate. You're not there to convert. So what you do is you do it with your actions. Actions speak louder than words. Yes, I work at such and such, some shelter, some maternity home, some pregnancy center. And that's where you begin to put your money where your mouth is. And they begin to and then they begin to question, wow, he or she is really committed to this position. And that's why I think it's more in your actions. So I really, what was your first name?
Joel.
Joel, John. I really appreciate that question. Thank you. What are there any questions here? Don't be shy. Yes, sir.
How does your practice go about patients and those other issues?
Yeah. Well, one of the issues that comes up is in vitro fertilization. And we simply tell, because once again, life begins at conception, not at fertilization, rather than implantation. And many in the medical community today believe that life begins at implantation, which is about 7 or 8 days after conception, or after fertilization. That change came about in the Williams textbook on obstetrics back in 1973, right when Roe v. Wade was legalized. Because some IUDs, some contraceptives will impact will prevent implantation by thinning the lining, so to speak. So for our IVF people who want to go to IVF, we simply tell them, before you go to IVF, you and your spouse, you and your partner need to answer one question. Are those embryos my children or my property? Because if they are your child, you probably shouldn't freeze them. You probably shouldn't experiment on them. You probably shouldn't make 15 to put back 3 and freeze the rest. If they're your property, you can do anything you want with them. And I can tell you that many, 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 many mothers who have gone through IVF and have frozen embryos on stash, or who have made, 10 embryos and they put back 6 and none took, the loss of those patients are just as grievous as if they lost a child at 6 weeks or 10 weeks. So for the IVF community, what was your first name, buddy?
Edgefor.
Say that again?
Edgefor.
Edgefor John. We tell them, you have to make that distinction. Are they your children or are they your property? If they're your children, think twice. If they're not your children, you can do whatever you like with them. In regards to contraception, we use hormones in our practice for medical reasons, but we've kind of gone green. We don't believe that fertility is a disease. We don't believe that we should be spending our time trying to suppress a woman's cycle. If she has a real medical reason, which many have, we might use hormones to go after it. But if they're just coming in for contraceptive purposes, we don't provide that service in our practice. And more patients are coming to this idea of a green approach to gynecology. Meaning, wait a second. And so this is this kind of radical distinction that I'm talking about. Our whole approach to reproductive health is a lot different than what's out there in the community. In OBGYNs today, it's mostly hormone them between 15 and 50, put them on a little bit more hormones between 50 and 60. And I think women are beginning to say, time out. Sure, it's going to raise my risk for breast cancer and for my risk for strokes and heart attacks, but it's going to improve my risk. I'm talking about menopausal hormones here. Wait a second. I need to make better choices, because up until now, doctors just said, I know what's best for you, do this. And I think women are kind of taking things in their own hands and saying, wait a second, I really want an alternative. So once again, we're getting lots of people who've kind of gone the contraceptive route saying, I don't like the way it makes me feel, I don't like the side effects, what else is there? And we're beginning to teach them about some of the fertility awareness methods. And so that's what we're doing. So yeah, we use them for medical purposes when we need them, but we don't just routinely put people on the pill, because we want to cooperate with them rather than suppress them. We don't think children are not sexually transmitted diseases. The whole issue of the whole connection between abortion and contraception as a backup. So anyway, it's a great question. Yes, ma'am.
So how do you suggest that sexually active people who don't like get pregnant stop? If you don't provide contraceptives, what are the most methods?
When are you most fertile during your cycle?
During ovulation.
During ovulation. What happens is that we're very upfront in our advertising. If a young family or if a young woman comes to us who wants contraception, hormones for contraception, they can go elsewhere. Every other doctor in our area does it. But if they're interested in learning about their fertility, learning the language of their body, and not wanting to repress it with hormones, because the hormones made them gain weight or had headaches or whatever those mild side effects are, well, we teach them in a very practical way about when they're fertile. And if they're interested, if they want to have sex during that time, they can use condoms. If they don't, they don't. But that's kind of up to them in that regard. But we try to teach them, we try to educate them about their body, because there can be a different way. And this is not your mother's rhythm method or your church's whatever. This is good science. In fact, the In Vitro Center, we used to look at spin barkite, which is the stretch of cervical mucus at mid-cycle due to estradiol. And Dr. Georgiana Jones, a god in the field of OBGYN, she made us look at spin Barkay on every single IVF patient we had. I remember when I came to her and I said, you know, Dr. Jones, I don't think I can abort babies anymore. I want to use that stretchy cervical mucus and I want to kind of turn it into a fertility. Oh no, John, that doesn't work. Men and women don't have that self-control, and you know, you can't always do that, and you know, they're gonna make mistakes, and well, yeah, I mean, but you know what? More and more women are beginning to choose this cooperative means of working with their body. Because once again, you're only fertile 12 to 24 hours a month, and we can help you pinpoint that. The World Health Organization talks about, back in the 1985 study that looked at 94% of women can identify their fertile phase in 3 months. So we try to get you in tune with your body and begin to listen to it and get your significant other to begin to listen to it. It's good for PMS, it's good for sex, it's good for lots of things. So that's just our approach. What else? Yes, ma'am.
Dr. John, I didn't catch how to pronounce your last name.
Bruchalski, but Dr. John's just fine.
I'm Barbara Holt. I was president of North Carolina Right to Life. And I found a couple of your comments interesting. And the reason I want to bring them up now is because currently I'm lobbying at the legislature. And one of the bills that we have is Women's Right to Know, which would provide that woman, that mother who is contemplating abortion with information,
Yes, ma'am.
which includes fetal development, and also alternatives to abortion, the medical risk, and all of that type of thing.
Yes,
What
ma'am.
we have found is that that when mothers get this information, and that's one reason why pregnancy centers are having ultrasound machines, trying to buy those ultrasound machines so that they can show that unborn child. So I was a little concerned, and I don't think you meant it quite the way
No.
it came off. So I just
No, I appreciate it.
I wanted to revisit that.
Yeah, sure.
Because we feel like the child is very important for two reasons. One, there are a lot of mothers that see, you know, they would find, even the Supreme Court has said this, they would find it dispositive to see this child, to know about this child in making this decision. And secondly, having the focus on the unborn child has, I think, changed the abortion debate in our country and caused so many people to rethink their position on abortion. The whole discussion about partial birth abortion, because the focus then was on the child.
Right.
The focus was what was happening to that child. And when people see, if they don't see the child, then they can sort of dismiss what's going on,
Right.
and what abortion is.
No,
So
I
could
thank
you
you. No, I listen.
Could you revisit that?
No,
Because I don't
absolutely.
think you meant it the way
Well,
I
no,
perceived it.
I don't, but I think that what happens, what's very challenging to me is that after 38 years, we still have 1.2 million abortions. And the reality is that back 30 years ago, we didn't know about the humanity of the child. Bernard Nathanson does the ultrasound. Oh my God. Thank you for coming. He sees the unborn child. Oh my gosh, I'm going to change my heart on this. We have pregnancy centers out there now showing ultrasounds. And it helps tremendously because it's it's like a stool that, by the way, what was your first name?
Barbara.
Barbara, John again. I'm trying. Barbara, it's like a three-legged stool. You need the humanity of the baby, the unborn, the caring for the whole person, and really looking at, supporting the woman. And unless you have all three of those, but I have to be honest with you, why do you think pregnancy centers put ultrasounds in their facilities? Why do you think because I was very close to CareNet, before it was CareNet, about the medical model of pregnancy centers. Why do you think, in your professional opinion, why do pregnancy centers have to bring in an ultrasound? Besides, well, why do they have to show the mother the unborn child? Why? It's because doctors didn't help them. Once again, folks, and I'm challenging all of you, who here is part of the Newman Center? Lenin said that if I met one St. Paul, I wouldn't have been a communist. The reason why there's abortion today is not because of them, it's because of us. People like Barbara have given their life and their time